My name is Anmol Agarwal, and I'm from Zen Onco team. So, yeah, so we are really happy that we are conducting this session with you. So, I just wanted to check: are you like comfortable with Hindi also, sir, or you just no?
My Hindi, my grammar is atrocious. Hindi.
No problem, no problem. So I'll just keep everything in English.
So the
Yeah.
people around me are also laughing, and seconding. I shouldn't be talking.
Sorry, my bad, my bad.
It's just that we don't speak Hindi routinely, so
Yeah.
Wait.
Okay.
So it's gonna get.
Hello, everyone. So here we are with Dr. Poovamma, and here it's very delighted, our pleasure to have Dr. Poovamma in our talk today. So let me introduce myself first. I'm Anmol Agarwal from ZenOnco.io and Love Heals Cancer. At ZenOnco.io and Love Heals Cancer, we guide cancer patients on their end-to-end cancer treatment, on their entire cancer journey from beginning to end. And we are basically dedicated to and for cancer patients. And in this regard, in this Breast Cancer Awareness Month, we have invited Dr. Poovamma, who is a consultant at Cytecare Cancer Hospital and has several years of surgical experience, including super specialization in breast oncoplastic surgery. She is the first graduate of the Rajiv Gandhi University of Health Sciences program for the fellowship in breast diseases. Her professional experience has spanned across Mazumdar Shaw Medical Center and Manipal Hospitals, Bangalore. She is also involved in several teaching programs and is a faculty for fellowship in breast diseases and cancer, and also a faculty at DNB General Surgery Directorate National Board. She has been credited with several publications and paper presentations. She is also a member of Breast Surgery International, Society of Surgery, and the Association of Breast Surgeons of India. So really, really delighted to have you here with us, Dr. Poovamma, and we'd like to have some words from you in the beginning, and then we'll continue with questions.
Thank you, Zen Onco, for having me here. And yes, October is during the month of October, we hold awareness sessions about breast cancer to increase awareness about breast cancer in the population. Because breast cancer is the most common cancer in women in India, and the know-how about breast cancer is very low, and patients still turn up very late for diagnosis, and many of our patients turn up in stage 3, stage 4 with poor, long-term outcomes. And I think it's very, very commendable that we should increase awareness, because that's the key in getting women to walk in early. And cancer treatment in India is excellent. It is at par with treatment in the West. We are not deficient in any way, I would say that. And early breast cancers have excellent long-term outcomes, with stage 1 breast cancer having cure rates of more than 90-95%. And yet in India, for every 2 women diagnosed with breast cancer, 1 dies of it. And this is mainly because they're all diagnosed late. So I think we should have a lot more sessions, because it's not really about education. I have highly educated women, having glorious careers, I should say, doing really well in their spectrum of whatever they're doing, and yet they present to us late, because breast cancer comes in with very few symptoms in the early stages, and that's why it is picked up late. And we have to increase our awareness about that in all our women population.
Definitely, yes, that's very much needed. So on that, I think on the very first question, we would like to know if you can help us understand what are the major signs and symptoms of breast cancer. We'll start with there.
So breast cancer is a very, very silent disease, even up to very advanced stage, and only when it's very advanced and moved away from the breast to other organs, when you have like serious signs and symptoms, I would say. So the most common symptom of breast cancer is usually a painless lump in the breast or some kind of thickening in the breast. And this is the reason a lot of women procrastinate about it and do not worry about it when even though they have detected something abnormal in the breast, because it's most of the times completely painless. It's a harmful, benign appearing small lump in the breast or little alteration in the breast, and not causing them any problems or any symptoms. So many times, many people will say, no, how can you tell me I have breast cancer? And sometimes I'm telling them I have stage 3, stage 4 breast cancer. And they're like, I just have this lump in my breast and I don't have any symptoms. I don't have weight loss. I don't feel sick. I don't feel tired. I don't feel weak. I'm eating well. And these are some of the set of questions many of them ask. I don't have any of this and you're telling me I have an advanced stage of breast cancer. So I think what we need to get across is the only symptom of breast cancer is a change in the breast. And most often it is a painless lump in the breast, sometimes associated with pain. A very small set of patients may just complain of pain in the breast and no lump. You could also have some kind of thickening in the breast. Those are the most common components. But the other things which we have to look for is any kind of nipple discharge has to be evaluated. You can have a fluid like, clear water like discharge, yellow discharge, a bloody nipple discharge, or you can have changes in the nipple where the nipple looks sore and ulcerated, or a nipple is pulled inwards, retracted, or you could have it, pulled towards one direction. Or when you look at two breasts, one breast might look much smaller than the other, or can look much bigger than the other. The whole breast looks swollen, and the skin of the breast appears different compared to the opposite side. The skin look very red with very prominent veins. It might feel a little thickened. The skin can look like an orange peel. So I would say anything appearing different on the breast needs to be evaluated, irrespective of age. We invariably think of breast cancer as a disease of the old, and that's a wrong misconception. It's a misconception. If you look at the Indian data, nearly half of the breast cancers in India are occurring in women less than 50 years of age. And we talk about screening, and many times people think only about above 50. Do I need to go in for an examination? But a lot of our women fall in the 40 to 50 age group, and some of them are even younger than that. So I would say about 4% of breast cancers occur in women in the 20s, about 16% in the 30s, and about 28% in the 40s. So if you collectively look at it, nearly 48% of breast cancers are occurring in women less than 50 years of age. And these people are invariably thinking, I'm too young to have cancer, so it's not a cancer. And they wait on the symptoms, though they have felt something different or abnormal in the breast. They wait on it, and time is lost. And I think with breast cancer, time is the essence, because the stage at what we diagnose is very important. The more the advance in the stage at diagnosis, the worse is the long-term outcome. The same is true when I say early detected breast cancers have an excellent long-term outcome. And that's why awareness is very important. Any change in the breast lasting more than a month needs to be evaluated. So the take-home message I would say is any kind of a lump in the breast, thickening, especially painless, needs to be evaluated. Any kind of a nipple discharge, any kind of a change in the nipple size, shape, change in the breast in shape and size, any kind of a lump in the underarm needs to be evaluated.
Right, rightly said, doctor. So when you say 1 month, anything greater than 1 month, is that the standard guideline, or should we
say it's no? For older women, any newly detected lump, I would say, immediately get it tested. Please don't even wait a month. I'm talking about a month only, say, for the younger people, menstrual women who feel a lot of bumpy changes in the breast because of the menstrual cycles, the breast can look and feel different. So any change which is persisting beyond one menstrual cycle for them, I would say, have to be evaluated. Okay, and that's why breast awareness is very important. So we always talk about breast awareness, where no two women have breasts which are similar. okay? And even for an individual woman, the breast is a very dynamic organ. It undergoes a lot of changes every day throughout the month, which corresponds to your menstrual cycle. So you can see a lot of changes in the breast throughout the month. And that's why you need to be aware as to how your breasts look and feel like, and how it changes, say, before your period, and after your period, how it changes. So always we say the best time to examine a breast is post your cycles, ideally day 7 to day 10. And that's the best time to examine, because that's the least, the amount of bumpiness you would feel in the breast is least at that point of time. So if you say examine your breast just before your periods, the whole breast can feel very different, can feel very lumpy, and you could get really perturbed thinking you have a lump in the breast. So that's why you need to be aware of what your breasts look and feel like.
Yes, exactly. And on the same lines, so how much do you think the regular checkup of breast cancer symptoms will help in the prevention of breast cancer?
So breast cancer is one of the few cancers where we actually have a screening program. And one of the few cancers where we can screen and detect cancer way before the woman would realize that she has cancer. So usually we say with self breast examination, clinical breast examination, and say a regular mammogram once in a year, once in 2 years, you can pick up breast cancers very, very early, compared to say a woman who's examining herself, or not even examining herself, or examine themselves once in few months or rarely. So yes, with breast awareness, self-breast examination, and regular mammograms, most cancers can be detected early in stage 1 and stage 2, and that's why we do advocate going for these checkups.
Yes, right. So even in this times of COVID-19 pandemic, so we understand that self-breast checkup is very important, because going to the medical centers would not be always available. So on the same lines, we would like to know, what should cancer patients keep in mind during COVID-19?
So I think because this COVID-19, every other illness has taken a back step. And we are seeing a lot of women coming to us with advanced stage cancers. And I've had patients who told me, I've had this lump from more than 6 months, from more than a year now. I noticed it, in the first lockdown, or when COVID just started. And like I told you, it's a painless lump, so it didn't bother me. And I had, people with somebody else with COVID falling sick. So I said, okay, let me, it's not troubling me. Why go to the hospital right now? And so many of them, when we're working them up, are in stage 3, stage 4. And, the whole time is lost. Something which would have been curable last year has become a metastatic disease, meaning a cancer which has spread beyond the breast to other organs. So here, the long-term outcomes are poor. We say 5-year survival rates for a metastatic breast cancer is down to about 25-30%. And the same thing, say, would have, if you had picked it up a year earlier, I'm talking of cure rates which are more than 80-90%. And that's the drastic difference here. Where we could have cured a cancer, we're landing up telling our people, it's spread, it's spread. We can control it, we can't cure it. And so yeah, COVID has played a huge havoc. And I would say, yes, we have to be careful about COVID, because we've seen patients or women, with or even sometimes caregivers who have died because of COVID and not because of cancer. So we do have to be. It's a double-edged sword. We have to see the take adequate precautions, I would think, and still be evaluated. If you feel there's something wrong in the breast, don't delay and wait. I would say the message to take home is, maybe when the numbers are very huge and, there's acute shortage of medical facility. Yes, we've seen that during the acute first wave and maybe the second wave. But I think now COVID is decreasing, and we're not seeing an acute shortage of medical services. And I think we should wake up now. And if anybody is having any of these kind of complaints, please don't wait anymore. We've already lost quite a bit of time.
Yes, exactly. And also on that front, we understand that all these cases, there are some kind of barriers. So what do you think there are barriers that prevent women in our society from doing regular breast cancer checkups?
So there are, I think, multiple barriers. Okay, women tend to kind of, keep their health at the back end. It's the last thing on their mind, I would say. So there's work, there's family, there's children. All of this takes precedence, and their own health becomes the last thing on their mind. Uh, um, there's also a little bit of fear about cancer. They think, okay, if I don't get it examined, maybe it'll go away. And so they wait on it because they don't want to confront it and meet the doctor to get it evaluated. They hope with time it will go away, which probably doesn't happen. Two, they're very busy with work. And like I told you, most often it's a painless lump. They're not giving them trouble in any way. And people have this misconception that, if it's cancer, they have to be feeling tired, they have to feel unwell, they have to have pain, they should, have loss of appetite or lose weight. The typical symptoms you kind of see in a movie for cancer, right? They have this in mind and they think, okay, I don't have any of that, so that can't be cancer. So let me wait on that. For some set of people, maybe access to medical care is not easy. They're living far away, or they're so caught up with work that they don't have time to, take a leave and come back and come to a hospital and get themselves evaluated. For many, it's just the thing about not putting the health as the first priority, I would say. Sometimes I've seen some people end up asking us, can I come back after a week because, my child has exams, or I have busy meetings at office. So can I push it by a month? Can I push it by 15 days? And I think the understanding that, cancer can wait, and they can, give it a second priority. I think that needs to change, because people have to understand that with cancers, early diagnosis is very important. Many of the cancers diagnosed early do well long term. Having said that, again, when we detect cancers late, even with all the advances in medical science, we can prolong life, we can control it, but we can't cure it. And so time is of the essence with cancer, I would say.
Yes, exactly put. So regarding the treatment options here, when we understand, okay, there's some person who is diagnosed with breast cancer, is surgery the only way out of breast cancer, or there are many other ways?
So when we talk about treatment for breast cancer with the intention to cure it, we use multiple modalities to treat breast cancer, and for curable cancers, surgery forms a huge component of the treatment. So it's usually surgery with some kind of additional treatment, either in the form of chemotherapy, hormone therapy, and if required, radiation therapy and targeted therapy. Yes, for curable breast cancer, surgery does form one of the pillars of treatment, I would say. So there are different pillars for treatment, and surgery forms a huge component of treatment for cure. Yes, as of now, we cannot do away with that surgery. But having said that, we've moved away from the radical mastectomies, meaning to say where we have to remove the entire breast, sacrifice the entire breast for cancer. We do not do those routinely at all. We can easily save the breast in case of a breast cancer, maintain very good aesthetic outcomes, and give the women a very aesthetically pleasing breast following surgery. So it's not where we don't do any more mutilating mastectomies. We don't have to remove muscle as long as they come early. So sometimes with advanced cancers, we don't have a choice and we have to sacrifice the breast. But even for these set of patients, we do offer immediate reconstructions, or other forms of reconstructions, or use of prosthesis to mitigate the the effects of surgery. But for early detected breast cancers, easily the breast can be saved without major complications of cancer coming back.
Yeah, that's very helpful in the sense of the people who are getting diagnosed with cancer to understand what the implications are. Also, there's some new therapy that we keep hearing about, hormone therapy. So would you like to shed some light on what it is exactly and how is it helpful in breast cancer?
So with breast cancer, we say, no two breast cancers are the same. Okay. There are different subtypes of breast cancer. We look at the molecular level of the tumor. We look to see at the molecular genetics. what kind of receptors the tumors are, expressing, how can we hit the cancer with, what are the different types of ways we can hit the cancer with. So one type of breast cancer is hormone positive variant of breast cancer, meaning to say it responds to hormonal therapy also. So for these subset of patients following surgery, we can do away without chemotherapy if we feel the tumors are very small, or say the tumors have not spread to the lymph nodes. The rate at which the tumor is growing is low. We do genomic assays to see whether chemotherapy is of any benefit or not, versus say giving only hormonal therapy. So hormonal therapy is most of the times a form of a tablet which kind of blocks the hormones to control the cancer. So yes, it is a type of adjuvant therapy, we would say, an additional therapy with surgery to control cancers. So it can be used for early breast cancers. Again, here I say early breast cancers, that's the thing there. If detected early, we can do away without chemotherapy. For some set of breast cancer patients, we can give them hormonal therapy.
Okay. And how do you generally access a patient and determine what kind of treatment they require?
So when any person walks in with any kind of symptoms of, symptoms in the breast, we always start with the clinical breast examination followed with the mammogram, and then we do a biopsy to prove that, whatever we are seeing is a cancer. With the biopsy, we also do the subtyping, what kind of a subtype of a breast cancer it is. After that, we always do a metastatic workup or a staging workup to see at baseline what is the amount of tumor we have, where is the tumor located, is it located in the breast, has it spread to the regional lymph nodes, has it spread beyond the regional lymph nodes to rest of the body, has it spread to organs like lungs, liver, lung, brain, bone. And depending on the stage, then we start the treatment. So the baseline workup always will include a clinical breast examination, a mammogram, biopsy, and some set of a staging test, either a complete body PET-CT scan, or we do a CT scan of the lungs, the liver, and look at the bones also to see whether cancer has spread there. So those kind of forms the subset in the initial set of investigations we usually would do for a woman.
Okay. Also, on the side effects part, there are a lot of misconceptions. So what would you have to say about how to manage the side effects?
So yes, chemotherapy, there is side effects from every form of treatment, right? So with surgery, you do have pain. Maybe you have pain at operated site. If you've lost an organ, that's a completely different matter. So that can be, well, we give adequate medications to keep them as comfortable as possible. Coming to chemotherapy, yes, chemotherapy does have its set of side effects. People have this misconception that chemotherapy is painful. Okay, chemotherapy is not painful. It is most often just a drip with medicines going inside. Different set of drugs have their own set of side effects, I would say. And what I want to emphasize is it's not painful. Most women tolerate it well. There are yes, some cosmetic set of side effects like hair loss, darkening of skin, darkening of nails, which are completely reversible again. Once you complete treatment, all of these revert back to normal. But other than that, there are some kind of side effects like vomiting sensation, nausea, vomiting, a little bit of, a tummy upset or loose motions or low-grade fevers, which are again well controlled with medication. And most of these women get good medication, pre-medication to kind of keep these symptoms under control. There would be a small set of patients who may develop more serious side effects, and that's why we say during chemotherapy, please be in touch with your doctor, inform them of any kind of new changes, new developments. Don't neglect any symptoms like fever, persisting fever, cough, colds should not be neglected. Inform your doctor and keep them posted as to how you're doing and what kind of set of side effects you're having, and they will monitor and they will make sure that they bring you back to normal and keep you well.
Yes,
nothing to be panicked about.
Right. So even after the surgery or chemotherapy or the treatment, whatsoever may be, person to person. So there's a follow-up plan that we as doctors advise to the patients. And we would like you to stress on how important it is for the patients to really stick to the follow-up plan that they have been given to or told to do so.
So the problem is with cancer, we cannot ever talk about 100% cure rates. There's always a possibility of these cancers coming back, and that's why we keep the patients on follow-up. We monitor them. Usually it's just a clinical examination, a chat with the patient to see how they're doing, any kind of new recent developments in forms of symptoms. And once a year we do tests, we do scans to see whether how's the body. Are they completely cancer free? Is there any kind of a new cancer coming back anywhere else? So yes, follow-up is important to monitor and pick up changes, any new developments, new recurrences of cancer. So yes, with like you said, again, with this pandemic, things have really gone haywire. We have data saying nearly 60 to 70% of patients have not gone back for follow-up. And there could be a subset who again have had a recurrence, and again it's been there's been a delay in picking it up and further delay in treatment. So routinely, yes, most patients, I would say, would stick to their follow-up plans, unlike like this once in a lifetime experience of going through a pandemic. But I guess we at that point of the pandemic, I don't know which takes precedence, because even getting out of the house may not have been safe. So having said that, okay, the pandemic is nearly, I think we're coming to the fag end of it, and please take time out now and go meet your doctor.
Right. So also regarding the frequency of doctor visits after the surgery, after the treatment, like the cancer is cured, so should it be more often than once a year, or what is the general guideline?
Yeah, so immediately after treatment, we usually recommend that patients come back once in 3 months to us for a follow-up for the first 2 to 3 years. And once you finish 2 to 3 years, then we move it to once in 6 months. And once we complete 5 years, then we say follow-up is just once a year. So we see them, that's the way we usually recommend follow-up.
Okay. And also after the successful treatment of breast cancer, once we are hearing that it can come back anytime. So is at that time self-detection also possible, or is it just through tests that we can detect the recurrence?
So with cancer recurrences, we talk about whether it's a in breast recurrence or whether it's a recurrence elsewhere. So maybe something in the breast, the individual may be able to realize, but otherwise sometimes it's symptoms, like say somewhere the cancer has spread to the brain. You can present with headaches, blurring of vision, a form of giddiness, which could suggest that there's cancer there. Or sometimes people could come with breathlessness, telling us that there's cancer which is spread to the lungs. Or you could have jaundice, which tells us it's there extensively in the liver. But most often, I would say we're doing these checkups once in 6 months, once a year. We're doing tests, so those will tell us way before the woman has these symptoms. The tests will tell us there's something lurking in these organs. Most often, I would say.
Yes, right. Also, the diet plan, the lifestyle plan, everything impacts in today's world. So what do you think is the importance of a healthy lifestyle for a cancer survivor, breast cancer survivor?
So I think even going beyond survivors, so I would say for everybody, it is said that nearly 30 to 40% of cancers in general are related to our lifestyle, related to our diet. So with breast cancer, again, it's a very, very complex mechanisms of, the weight of the individual. Obesity is a very complex mechanism for breast cancer, premenopausal versus postmenopausal breast cancer. But ideally, what we would say is don't make drastic changes in your weight when you're going through therapy, because your body will not be able to handle all the changes you are making, plus the treatment and all that. But on the general, we would say do make healthy lifestyle changes, do adopt more healthy lifestyles, eat more plant-based, vegetables and fruit-based diet, cut down on processed foods, packaged foods, and eat healthy in general. And I think the other component is actually physical activity. Physical activity is very important. It goes a long way in preventing cancers and also preventing recurrences. For hormone positive breast cancers, there have been multiple things which have been studied other than the treatment, which can decrease risk of breast cancer. And it has been shown that maintaining the ideal body weight or reducing weight if you're obese, and also incorporating exercise into your daily schedule. 30 to 40 minutes of exercise, moderate exercise, 5 days a week with weight reduction can go a long way in preventing recurrences, which is, I think, difficult to do and incorporate, but is very helpful though. And so we always tell our patients, make small changes, but which are lifelong lasting changes with your diet and exercise, and stick to these plans.
Yeah, that's completely right. And in the end, we'd like to know, how would you like to motivate our young females to, go get up and go ahead whenever they have any of the early symptoms you mentioned? So any words of motivation for our young females diagnosed with breast cancer?
So the most important thing I would say is early breast cancers have an excellent long-term outcome. More than 95% cure rates for stage 1 breast cancer. So don't be afraid, because just being afraid could make you land up and present to your doctor late, where time is of the essence, and we've moved away from a stage 1 breast cancer to say a stage 2 or stage 3 breast cancer. It's become very common. There's no stigma involved with having cancer. It's better to be aware than ignore your symptoms, and most women do well, and there is absolutely no restrictions to your lifestyle or what you can do or what you can't do. It's just a brief interruption from your otherwise normal life, which you need to go to the hospital for a few visits to get a treatment. But it's better to get it evaluated immediately than to land up in an advanced stage where your doctor's hands are tied, they can't do much for you. It's better that, like, having said that's what is important. Detecting it early is important. That's the key there. So please don't wait on it.
Yeah, and also just around male breast cancer, there's also something which is getting in the males. So what is your word on it?
So males also have breasts, but not as well developed as the female breast. So the incidence of males having breast cancer is obviously much lower than women, but it is said that 1 in 100 men can develop breast cancer. Okay, so men too have breast cancers. Stage to stage, the treatment, everything is the same. There's absolutely no change in how we stage the cancer or how we treat the cancer. The only thing is, because the male breast is much smaller in size, usually they'll end up being diagnosed at a more advanced stage. That's it. But otherwise, stage to stage breast cancer is common, and it's normal. There is also something called as a hereditary breast cancer. Okay, and I want to stress on this, that many people land up telling us, I don't have any history of cancer in my family, and why do I have cancer? Only about 5 to 10% of breast cancers are hereditary, meaning to say it run in the families. So about 90 to 95% women, there's no family history of cancer. But in families where there is an abnormal gene, most often in the BRCA1 and BRCA2 genes, there is a lot of clustering of cancers in these families. You can have females with bilateral breast cancer, ovarian cancer, men with breast cancer. Here, this subset of men with the hereditary form of breast cancer, the cancer rates in these men are much more higher than in men who don't have an abnormal gene. But yes, men too develop breast cancer, and now we have societies for breast cancer for men, because they are a neglected sublot.
Yes, right. Thank you, Dr. Poovamma, for answering all these questions. And it has been really great having you here with us. Thank you for all your insights. This session has been very helpful in spreading awareness about breast cancer, and we are very pleased to understand the key messages that has come across with this chat is time is the essence, and self-examination is crucial. Early detection is very important, and there is a survival rate of more than 90%, as you mentioned, which are massive numbers. So I think really a big thanks to you for letting us know all these things, and it really sets a positive tone in all the audience who are listening to this and all the breast cancer caregivers, survivors, community. So it really helps and people understand and spread the message. So thank you very much. Anything you wish to add or say?
What I would say is breast cancer has become very common. So I think invariably we know somebody, in our extended circles who have had breast cancer, and be supportive of these people. Please don't, keep asking them questions about their recurrence or how they're doing. They're doing fine, and let them do well. And in your own circle, please listen to the women around you. Someone tells you, I have a lump in the breast. Don't underestimate their ability to detect something. Many a times women, they would have told somebody in the family, but they are told, I think you're imagining it, let's wait and watch. So when somebody tells you something, please listen to it and get it evaluated. That's what is important.
Yes, that's very rightfully said. Thank you, Dr. Poovamma, once again, for your valuable time here with us. And it was really, really nice hearing to you. Thank you.
And thank you. It was a pleasure.
Thank you.